Ethical nursing care of transgender patients, an ethical research project for nurses. Ethical principles of nursing. The nursing population has taken a vow to always abide by the ethical principles of autonomy, beneficence, non-malfeasance, and justice. By promoting patient autonomy, we recognize their right to decision-making for themselves and to promote and respect their wishes. Through beneficence, we use compassion and are to always act for the good of others, and all the care we give them should be non-judgmental. Justice is of particular importance in caring for transgender patients, as all care and decisions made by medical staff should be fair despite the patient's gender, sexual orientation, or identity. The principle of justice affirms that transgender patients are equally entitled to a fair distribution of healthcare resources. However, transgender patients are less likely to have health insurance and access to medical services. Non-malfeasance, better known as to do no harm, is to be observed in order to always ensure the safety of every single one of our patients. If a transgender or gender nonconforming individual is treated differently or not cared for appropriately by their healthcare team because of their identity, the ethical nursing principles have been violated. What is the problem? As nurses, we have an ethical duty to always treat our patients with decency and respect, to be welcoming to every single patient we encounter, and to avoid passing judgment. Caring for our patients in their time of need should never be skewed by personal beliefs, bias, or hatred. None of the patients we will encounter are the same, but they should all be treated that way, as ethical nursing care is driven by what is good and moral. In our nursing careers, we will constantly encounter patients from all walks of life, with a variety of health and other issues, those who have colorful pasts, those who are not always kind to us, and those who are just simply different than us. Nursing and other healthcare professionals have a duty to our patients to be educated about sensitive issues and be aware of our own cultural biases, as well as seeking ways that we can do better. What does the term transgender mean? The term transgender is used for those whose birth sex does not match the gender they identify with internally. The terms gender and sex are often used interchangeably, when in fact the two are very different. Each person is assigned a sex at birth based on their external genitalia. Each person also has an internal sense of self, known as a gender identity, which develops over the course of a person's life, and which may change over time. For centuries, the notion that there are only two genders, which correspond to two distinct physical sexes, masculine men as males, and feminine women as females, has been deeply ingrained in our society. This construct is known as the gender binary because it offers only two options for gender identity. What types of issues do transgender patients face in healthcare? This is some of the tough stuff transgender patients have to overcome in healthcare. Healthcare inaccessibility, discrimination and fear of discrimination, higher incidence of cost-related healthcare barriers, distrust of healthcare professionals based on past experiences, disproportionate rates of mental health issues, and difficulty obtaining coverage by insurance for transitional surgeries. Here are some statistics on care. One large study of transgender people found that 28% had postponed necessary medical care when sick or injured, and 33% had delayed preventative care or did not seek it out at all. Patient-provider trust often determines whether a patient will follow a provider's recommendations, so it is important that patients feel comfortable disclosing their gender identity. Here are some more statistics specific to transition. Top surgery is where the breast tissue is removed to masculinize the chest. The World Professional Association of Transgender Health Standards of Care criteria requires obtaining one letter of support from a mental health provider competent in transgender health. You will need a mental health evaluation to receive a letter of support and have well-documented gender dysphoria. That process alone can be lengthy on top of stressful. Of the 57 insurers evaluated, bilateral mastectomy, female to male transition, was covered by significantly more insurers than breast augmentation, transition from male to female. This is 96% versus 68%. Additional prerequisites for coverage that extended beyond WPATH guidelines for top surgery were continuous living in congruent gender role, 2 referring mental health professionals, and hormone therapy before surgery. Hormone therapy was required in significantly higher proportion of male to female policies compared to female to male policies, 90% versus 21%. In addition to the marked intercompany variation in criteria for insurance coverage that often deviated from WPATH recommendations, there are healthcare insurers who categorically deny access to top gender-affirming surgery. How do we as nurses know how a patient identifies? A simple intake form, like the one shown here, allows a patient to mark if they identify as male, female, transgender male, transgender female, genderqueer, or more than one. There's also a space for the patient to mark if their birth certificate shows an assigned sex of male or female. This can be important as the patient's care may have to be based on their birth sex, even if they are in a transitional period, depending on where they are on that journey. As nurses, what can we do to take better care of our transgender patients? Make an effort to learn about how the patient identifies instead of assuming. Don't be afraid to ask a person their preferred pronouns and simply apologize if you make a mistake. This is new for many people. Keep in mind that these patients may have had a negative experience in the healthcare setting, and they may be fragile for that reason, in addition to the health issue at hand. Show respect and dignity to all of your patients. Treat your patients how you want yourself, your family, and your friends to be treated. Call your patient by their preferred name when speaking with them. Let's do better. The best course of action to provide ethical nursing care to transgender patients is to view them the same as we do our heterosexual birth gender identifying patients, not as male, female, straight, gay, lesbian, bisexual, or transgender, but simply as people. I don't expect all nurses and other members of the healthcare team to know how to deal with complex transgender health issues. But I do expect us all to do what we can to help our patients and research the care that they need and to be aware of their unique needs. We don't have to view these patients differently. This is a choice that we can consciously make. We need to see them for who they are, people in need of medical help, entrusting us with their lives. Having an illness is scary enough without fear of how you will be treated by the people who are supposed to be devoted to caring for you and doing you no harm. Being transgender is only part of who this person is, and we must care for them as a whole. Together, we can do better. On this page, I have listed all of the references I used for my research topic. If you have a chance, I highly suggest reading at least a couple of these articles. It will give you a better idea of some of the health issues that the transgender population faces, and some tips on what you can do to make their healthcare experience better. Thank you.